Canada is currently the only country in the world with a universal healthcare system that doesn't cover prescription drugs. That's going to change.
Today in the House of Commons, I was deeply proud to introduce an act respecting pharmacare that lays out the principles essential for a national universal pharmacare in Canada.
I'll start by saying what this is not. It's not a plan to make all prescription drugs free. This first phase is much more narrow.
We need to be iterative about this to make sure that we're moving in the right direction.
So what's covered, what's not, and who is covered? Contraceptives are the first big category in this proposed pharmacare plan. We don't have a specific list, but speaking to reporters, the health minister mentioned a few of the most common ones. So birth control pills, both the monthly and emergency kind, IUDs, both the hormonal and copper kind. The final list might be bigger than that, but that's what we know right now. Something like condoms, those are just off the shelf. Those aren't covered.
Now folks will be able to have access to contraception under their own terms. You're not relying on a family member, maybe your partner, so you're going to get confidentiality when you need to access that.
Second big category covered under this proposed plan, some diabetes treatments, both drugs and devices. And for this, we do have a more detailed list. So all forms of insulin would be covered. Glucose monitoring strips, covered. Syringes, covered. But in case you were wondering, Ozempic is not on the list. That's both a diabetes drug and something prescribed sometimes for weight loss. So broadly, birth control and diabetes drugs. That's it for now. And if you're wondering why these two categories of drugs in particular, it's partly about reach.
Waking up in a country where every single woman has access to the contraception she needs to control her future is an absolutely critical part of having a just society.
The government figures free contraceptives directly impacts around 9 million Canadians of reproductive age, because that stuff is expensive.
Young people coming in with their loonies and quarters and sort of putting them out on the desk, buying one pack at a time. I've heard of folks trying to stretch a pack, taking their pill every other day, not taking them as instructed.
Without insurance, the pill generally costs around $300 a year. An IUD, which usually works for around 5 years, costs up to $500. And it's women who largely pay for that.
Came off contraception because it's too expensive, really.
I'm from the UK, and I was really surprised when I came over that we had to pay for contraceptives. It seems absolutely ridiculous.
Diabetes also affects a huge number of both women and men. Close to 4 million Canadians have diabetes. And according to a recent study, some of those without insurance are paying as much as $18,000 a year to treat it.
Type 1 diabetes is super costly. You have your cost of insulin, you have blood glucose strips. If you're on a continuous glucose monitor, there's that cost.
Glucose monitoring devices are also used by some of the over 1 million Canadians living with pre-diabetes, meaning those with high blood sugar levels, which, if unmanaged, could develop into full type 2 diabetes.
If people don't manage their diabetes, they can end up with lots of different complications, emergency room visits, on dialysis. And so getting ahead of that and helping people access the drugs and supplies for diabetes is important.
But we should point out, stats show none of these drugs are among the most common prescription medications in Canada. Those would be meds for high blood pressure, high blood cholesterol, and mood disorders. And according to a 2018 study published in the Canadian Medical Association Journal, when it comes to drugs that were prescribed but were least likely to be taken because of the cost, drugs for mental health conditions topped that list.
I'm really curious as to how they selected these. It's not clear, but they do represent somewhat different population groups who would be benefiting, so that has some advantages politically in terms of casting a broader net in terms of who the beneficiaries are.
But that's phase one. Phase two, which comes later, is about expanding the program to cover a longer list of, quote, essential medications. According to the Government Advisory Council's final report on pharmacare, the initial formulary, and that's just a fancy word for list, would be a carefully chosen list of essential medicines covering most major conditions and representing about half of all prescriptions. There are already established lists of these essential medicines out there, which the government could use as a guide. Generally, we'd be talking about things like antibiotics, pain relievers, drugs to treat high blood pressure, mental illness, and HIV. So that was the what. What about the who? Who's covered? Well, the idea of a universal plan is that everyone in Canada is eligible, not just people without insurance.
This is for all Canadians. This is for everyone. It's a universal delivery of these two classes of medications.
So the idea would be anyone could go to a pharmacy with their provincial health card, hand over a prescription, and get these drugs for free. Seems simple enough. But this part of the plan was actually a really big sticking point.
Of course, lots of people have private insurance through their work.
According to Stats Canada, close to 80% of Canadians do already have some type of prescription drug coverage. 60% through private plans, generally employers. But the level of coverage does vary quite a bit. Some plans have co-payments, deductibles, yearly or lifetime limits. And according to the government, there's somewhere around 20% of people who have coverage but still struggle to pay for prescriptions. Grouping everyone together under one massive plan also gives the government that much more leverage.
By having all Canadians in that same pool, the government is really able to play hardball with drug companies to bring costs down.
The government also argues as the nature of work changes and more people become self-employed, contract workers, part-time, the number of people without coverage may change too. Overall, it's estimated between 27 and 45% of all Canadian workers do not have stable full-time jobs. So what remaining question marks are there? Well, one, the full list of covered drugs to come. That's a big one. Two, which provinces will take part? Quebec and Alberta have already said, we're not interested, and we want cash in lieu of opting in. But three, how much will this national pharmacare plan cost? Or even just this initial push covering these two drug categories?
What is your estimate? What are you starting out? Can you provide a little bit of transparency to Canadians about what you think this might cost?
Yeah, if it's okay, I'm going to get back to you on that.
When push came to shove, the health minister said the initial cost might be in the ballpark of $1.5 billion. But that could move in either direction, he said. So I wouldn't say he revealed that number gladly. The projected cost of this plan in full swing, once all drugs are covered, an estimated $40 billion a year. Though the health minister says that could be more than offset by the savings of buying in bulk. As for when any of this takes effect, possibly something within a year from today. Exact timing could depend on how the provinces react. The next phase of this plan, though, is so far off, it's set to become an election promise. Something we'll probably only see if the Liberals manage to stay in power for another term.